Welcome to Humanotic, unlocking the secrets inside your body and brain. Hello everyone, welcome back to Humanotic. In today's video, we will learn how to perform excision of a lipoma, explained step by step, specifically for medical and surgical students. This video will cover indications, required instruments, surgical steps, hemostasis and closure, post-operative care. By the end of this video, you should be able to confidently describe and perform lipoma excision in theory and practice. What is a lipoma? A lipoma is a benign tumor of mature adipose tissue. It is usually soft, painless, slow-growing, mobile, located in the subcutaneous plane. Common sites include the neck, shoulder, back, arm, and thigh. Indications for excision. Lipoma excision is indicated when the lipoma is painful, rapid increase in size, cosmetic concern, restriction of movement, diagnostic uncertainty to rule out liposarcoma, pre-operative preparation, before surgery, obtain informed consent, mark the swelling and incision line, ensure aseptic precautions, position the patient comfortably. Local anesthesia is usually sufficient. Local anesthesia used. 2% lignocaine with or without adrenaline. Instruments required. Required instruments include scalpel with blade number 15, artery forceps, dissecting forceps, scissors, needle holder, sutures, nylon or proline, gauze and antiseptic solution. Surgical procedure, step by step. Step 1. Skin incision. Make a small linear or elliptical incision directly over the lipoma. Incision should follow skin tension lines for better healing. Step 2. Deepen the incision. Carefully incise through skin, subcutaneous tissue. You will now identify the yellowish lobulated mass of the lipoma. Step 3. Blunt dissection. Use finger dissection or artery forceps. Gently separate the lipoma from surrounding tissues. Most lipomas have a pseudocapsule, making dissection easier. Step 4. Delivery of lipoma. Apply gentle pressure around the swelling. The lipoma is slowly delivered out of the wound. Avoid rupturing the mass. Step 5. Hemostasis. Identify and ligate any bleeding vessels. Achieve complete hemostasis before closure. Closure. Irrigate the wound with normal saline. Close the wound in layers if needed. Skin is closed using interrupted or mattress sutures. Apply sterile dressing. Post-operative care. Advise oral antibiotics if required. Analgesics for pain. Suture removal usually after 7 to 10 days. Send specimen for histopathological examination. Important exam points. Lipoma is benign but always send for HPE. Avoid incomplete excision to prevent recurrence. Sudden pain or rapid growth right-pointing arrow suspect malignancy. That's it for today's video on excision of lipoma. If you found this helpful, like, share, and subscribe to Humanotic, unlocking the secrets inside your body and brain, for more surgical tutorials made easy for students. Thank you for watching.